Hello, good afternoon po. Maulang hapon po sa inyong lahat. And thank you for joining us this afternoon. Ako po si Dr. Ana York Bondoc. And our topic today is something na ginagawa po talaga sa lahat ng pumapasok sa ospital. And ito po ay SWERO. Kayo po ba ay na-SWERO? In English, this is called intravenous therapy or IV therapy. So, kayo po ba ay na-SWERO na? Alam niyo ho ba kung bakit kayo naswero and what are the good points and the bad points po ng isang swero? Ba't ba siya natawag na swero? Actually, I don't know. So, pag-usapan po natin ito ngayong hapon na ito. Again, I'm Dr. Bondoc. I am an internist and a pulmonary specialist. I am trained in the US. I have a clinic in St. Luke's, Quezon City. Ako po ay isa rin pong 3-term congresswoman. And I'm also the mom of an 8-year-old at nandito po ako ngayon sa gitna ng bukid at palayan sa San Juan, San Luis, Pampanga. And I would like to say this morning po, kami po ay pumunta sa Kawit, Cavite to pick up the backup para sa bakuna. So you might want to see that po, nakapost po yung video sa amin pong Facebook. Meanwhile, please follow us on YouTube and FB Live. Like and subscribe lang po para malaman nyo po yung mga iba't ibang pinag-uusapan po nating health topics. And please put your questions below. We are very happy po to answer them. Lalo na po, I'm sure maraming magtatanong kasi po today na-announce yung bagong ECQ po sa Metro Manila na due to the rising cases of the Delta variant in Metro Manila. However, as we all know, pag nagkaroon po ng lockdown, yung hanap buhay naman po ng mga tao ang nakapeligro. So, let's talk first about SWERO. And if you have any questions about SWERO, ilagay. Questions about COVID, we will tackle them later. So, sige na po, and let's start. Ano nga ba ang SWERO? What's a SWERO? Ba't nga ba siya natawag na SWERO? In English, it is called intravenous therapy or IV therapy. I and then V. Okay? So, therapy. So, ito po is a means of delivering fluids, nutrition, and medications po directly into the circulatory system. Okay? So, ano ba ang simpleng explanation nito po? Yung fluid sa katawan na kailangan po ng katawan nyo, nutrition, kung hindi po kayo makakain, and other medications po ay dumadaan po sa through a SWERO, an IV, an intravenous into the vein. Dito po sa ugat po ng tao, and it goes, kasi vein siya, so towards the heart, ugat po siya papunta sa puso. Yung gamot nyo po goes straight to your heart. So it is the fastest and the most direct way to give medications to a patient. Okay? It is used sometimes kung hindi na po makakain yung tao or there's something wrong po with the digestive system. It's also sometimes used in an emergency or kung talaga pong diretso po gusto natin na maramdaman po ng tao yung epekto po ng inyo pong ininiksyon. And of course, there are also some medications that are primarily made for IV. So, meron pong oral, that's by mouth. Ito po, IV, that is by vein. Okay? Venous. Bakit siya natawag na SWERO? Hindi. I swear, I don't know. But if anyone knows, lagay nyo lang po. Okay, next question. Napuputol po ata tayo. Ayan. Ano ba ang dumadaan sa SWERO ng isang tao? Okay? Ano nga ba yon? What is in that bag na hinahang po ng mga nurse? Karamihan po, no? There's two kinds of SWERO po, no? Yung bolus, yun po yung push, IV push. And there's the infusion, yun po yung nakahang, no? Nakahang. So that is called the infusion, yun ang nakahang, and the bolus, that is the push. Okay, number one, fluids po ang dumadaan. What are fluids? Fluids po are calibrated po by the pharmaceutical company para ho it can either be normal saline. So dapat ho compatible siya sa dugo ng tao, okay? So there is normal saline, 0.9 lang po 'yon ng which the most parang similar to the body makeup. Then there's lactated ringers with with lactate. So iba't iba po yung mga halo ng mga fluids, but they are supposed to be compatible po with the blood. Okay? So meron pong with glucose. Kung hindi po kayo makakain, we do give you some glucose through your IV. And meron din pong mga, for example, accident victims or blood loss, yung tinatawag po nating colloidal solutions, we also give that po. Para parang it draws in water from the body. So yun po yun. Those are the IV fluids na ginagawa. The most commonly used in the world is 0.9 NSS. Ginagamit po yun. D5 with glucose, lactated ringers with lactate. So yun po yung the most common na ginagamit po. And we hang them when people cannot drink enough or if they need more fluids in their body. For example, may dehydrated po, no? For example po, sumusuka. Then that person needs to receive fluids kasi hindi na po niya matake, it cannot be anymore by mouth, sinusuka po niya. So we have to replace po the lost fluids and the lost electrolytes po sa SWERO. For example, meron pong na-dehydrated, let's say, nag-marathon. So isi-SWERO po yon to replace some of the fluids na nawala po sa kanyang katawan. Okay? If you are sick, you are losing, you're getting dehydrated po from fever, no? So we need to replace some of the fluids that are lost through IV. So number 1 po yan, fluids. Number 2, dugo. Okay? We do blood transfusion by vein. So people, ano dumadaloy sa SWERO? Sometimes dugo po ang dumadaloy sa SWERO. And that is what we call a blood transfusion. Okay? Number 3, iba't iba pong gamot ang dumadaloy sa ating SWERO. One of the most common are antibiotics. If you are very ill po, maghahang po sila ng antibiotics para diretso na po sa loob po ng katawan nyo. Hindi na po, yung oral, hindi na po gumagana yon pag talaga pong grabe po yung sakit ng tao, dapat diretso na po sa katawan. And the IV antibiotics are hung through an infusion. Okay? We do give chemotherapy also by vein. Yung mga ibang electrolytes, halimbawa po natuyuan nga kayo, you need sodium and potassium. Again, dumadaan po yung electrolytes. The most common is sodium and potassium po and glucose. Other medications po like anesthesia, pag mapapatulugin po kayo by vein, sometimes sa ER po, we do use IV for seizures, mga ganun po. IV for mga pampakalma, and things like that. There are some medications po na talaga ba IV. We either use some medications, we can push them pag talagang mabilis, like epinephrine, somebody coded, ganun po. IV push talaga yan. But majority is IV infusion. Nutrition, pag hindi na po makakain ng isang pasyente, especially matagal po, nasa ICU, the gut is not working, we do tend to give nutrition through the vein, and this is called parenteral nutrition. So yun po yan. I'm sorry, namatay lang po yung electric fan. So tinatawag po itong parenteral nutrition or IV nutrition. Okay? And we also use this sa mga CT scan. If you do CT scan, ganun po. They give contrast through the vein. Para ho magkaroon ng dye. No? This is like a dye so that they can see that on the CT scan. And anesthetics are given through vein, a lot of them. Okay? So next po. The importance of the SWERO, super important. Okay, let's say, kaya nga po, when you go to the hospital, di ba, almost immediately, pag i-admit na ho kayo, isuswero na po kayo, diretso na yun eh. So, you just already know na masiswero ka and masakit. So, talaga it's not gonna make you happy. Kaya lang, it's gonna make you better. So, eto lang, what is the importance of the SWERO? Super important. For example, somebody coded. Or let's say, may nabundol po sa harap ng ER. Okay? Tapos tinakbo sa emergency room. Say, sa Taft Avenue, sa harap ng PJ, sa Sagasana, bundol, tinakbo sa ER. What are the things that they will do in the ER first? The first thing that they will do, of course, is administer oxygen. Kasi pag hindi humihinga yung tao, malaking problema. Okay? Number 2 po, i-check po nila yung puso. Kasi kung hindi rin nagbi-beat, then we have to we have to shock the heart para mag-start, no? But the third most important, and kasabayan na po, I couldn't even say that it would be the third most important, we have to replace fluids. Especially if the person is bleeding o may nangyari po talaga mababa ang blood pressure, then we have to challenge the patient with a large amount of IV fluids immediately. Lalo na po, let's say, matagal hong nasaksak, no? 8 saksak wounds, nasa jeep, tinakbo sa ospital, but lost a lot of blood. Talagang kailangan hong ma-replace yun ASAP. So while they are checking your blood type and looking for blood, fluids ho muna or sa IV ang papalit po dun sa nagsisirculate po sa inyong katawan. If there's nothing circulating, you will die. So kailangan po talaga, SWERO is so very important during issues like this. Okay? Also, if you have no blood pressure, the first thing that we will do is pump fluids into the body. And we cannot pump that by mouth. Hindi po pwede. That has to be pumped po through the intravenous line. So, when somebody enters the hospital, yung nabundol nga po sa harap ng PJ, someone is ambu-bagging, someone is checking the blood pressure and the heart, and at least 3 people are trying to put IV lines. Okay? So, ganun ho ka-importante po si SWERO. So, I mentioned breathing, heart, and then fluids. But the real life po in the ER, in the CPR situation, halos sabay pong nangyayari yon. Because we cannot revive someone unless we can give them fluids and epinephrine. So, it's very important. We need to give fluids and inotropes. Ano po yung inotropes? Para tumaas po yung blood pressure and we have to beat the heart para ho tumaas. No? We need to provide action to the heart to beat para ho, kailangan stress natin yung puso para makapag-pump po talaga ng dugo palabas so that we can revive somebody. Okay? So, importance of SWERO, like 10/10, 100%, super important. It's also very important, aside from the trauma cases and the ER cases, very important po talaga na may IV line ng isang pasyente kasi nga ho, pag may nangyari, we need to push medicines. But more than that po, you need good veins, very important, kasi po, that's where you're gonna be receiving your gamots. Hindi po pwedeng inumin ng antibiotics, lalo na po pag seryoso na po yung sitwasyon. So, SWERO is so important. Okay? Next. And hindi man natin alam na important siya. Galit lang ho tayo dun sa nagsiswero. So risk, yes, it is important, but there are also risks po, no? The number one risk talaga po, pag may IV line, lalo, I forgot to mention, there is called the central line. Dito po sa, when we insert po big catheters and needles into the great vessels of the neck, yun po yung central line, or into the femoral veins, those are called central lines. Pag peripheral, sa kamay, sa paa, and sa baby, sa ulo. Okay? So, peripheral is dito. Okay? Kamay, paa, ganun po. Central, it is in the great veins of the neck. Pag talagang malaki na ho ang problema, diretso po kami sa liig, tumutusok. Pag medyo okay pa, sa kamay. Okay? So what are the risks? The number one risk po talaga of this, sometimes you think the risk is mag-through and through ng mga ugat. Masakit din yon. But the number one risk is really infection. Bakit? Kasi po, this is a foreign body that's entering your bloodstream. So, syempre, your skin is not that clean. Even though binebetadine naman ho, tsaka linilinis, But every day, may tusok po sa loob ng katawan nyo. Yung tusok na yon is a source po of infection. And line infections or IV line infections are very common po sa ICU. And they should be considered the moment a patient spikes a fever. Halimbawa, meron pong nag-temperature ng 39 dun sa loob po ng inyong ICU. 2 linggo na po yung pasyente. May SWERO sa 2 kamay. Ngayon, walang pulmonya, in-x-ray mo na, okay ang ihi. Ang dapat mong i-check next is, kumusta po yung mga SWERO ng pasyente? Because IV line infection can cause po sepsis at pwede pong ikamatay ng isang tao. So, very important po ang risk of infection. This also goes for yung mga taong nagpapaswero po sa kung saan-saan lang. This is not a joke. It is an important procedure. May pumapasok po sa katawan nyo and it has the potential po to directly kill you kung magkamali po sila ng lagay. Because we don't know kung ano po linalagay nila. So, for those who are thinking na biro-biro lang po yung magpaswero or let's hang vitamins or whatever. This is not a joke and it is a serious procedure. Okay? So, yun po yung risk of SWERO aside from the through and through of the vein, dinugo po, hematoma kasi po nag-through and through yung needle, lumabas po yung dugo. These are what we call hematomas po. But the most important is the risk of infection. Second risk po, yung risk of extravasation. There are, what's the meaning of extravasation? Yung lumabas po yung swero sa ugat. And then, some of the chemotherapies po and some of the antibiotics matatapang po talaga. So, pwede pong mabulok or necrosis po ng katawan po. Not ng katawan, ng kamay po, nung where they put the swero. Sa mga ganun po, it's better to put it in the central line kasi po sa peripheral, baka ako mag-extravasate o lumabas at magkaroon po ng maliit. It's like a burn, so hindi po maganda. Okay? So those are the risks of the swero. And the risk, syempre, masakit yun, risk din yun. Hindi po maiwasan, masakit talaga. Okay, I think that's it. Meron bang letter E? Wala na ata. These are the main points that I wanted to discuss about the SWERO or IV lines, and I hope that you learned something about it. I placed a number of questions that I frequently hear. So pag-usapan na lang po natin, please flex lang po sa baba yung my experience with the SWERO. And I will do my best to answer them po. Ay, may mga pictures pala tayo. I forgot. Okay? So, ayan po. That's the, pakilakihan lang po para makita ko po. I cannot see it. Sorry. Ayan. Yeah, that is called, that's an angiocatheter. Ini-insert po into the vein sa kamay. Do you see the meron po siyang nakalagay na elastic sa wrist. That is para po may stop po yung daloy ng dugo at maging mas prominente po yung inyong ugat. So that is one SWERO po. No? That's actually called the angiocat. I think it's a brand name or Abocat. May cannula po yan, may plastic, no? And later on, tatanggalin po yung yung needle, maiiwan po yung plastic. And then dun po ikakabit dun sa hinahawakan po ng tao yung end po ng tubing for the infusion. Okay? Ayan po. These are the fluids na hinahang po, no? This looks like NSS to me. Most of them are clear. Those, meron naman po, yung may kulay, usually antibiotics o gamot. Okay? Sometimes, eto lang I forgot to say this, sometimes when we want to give the gamot slowly, we can dilute it in like 1 liter of NSS po para mabagal na mabagal po yung pasok sa katawan. Sometimes we do that with potassium, with sodium po. Ayan, that is called a butterfly. Yan po yung frequently used sa mga kids. Sometimes adults, pag hindi po magtatagal, they tend to use a butterfly. Or for an IV bolus, you can use a butterfly. But most of the time po, we tend to use the one with the cannula. Meron ata akong picture po later. So yan po, diretso na ho yung needle. No? There's a needle that remains. Wala po tayong tatanggalin. So this is, diretso po yung needle. Pag matagalan po, tutusok po yung needle. So this is not really good for long term. Pero pag maliit yung ugat, we tend to use butterflies. Okay? Ayan, dugo naman po ang nakahang dito. We do use the IV access for blood transfusion po. Some of the fluids, mabilis po yung daloy, like fluid the challenge, ganon. But sa blood, mabagal din po. Ayan po, what are they doing? Ayan, IV insertion rin po yan. No, it's a dog. Okay, you see the pause, sorry. What I wanted to answer the question is, it's not only persons who get IV. Nakita niyo po, if you bring your dog to the vet, siniswero din po si doggy. So yes, this is a medical technique that is used for all kinds, including animals, ano po, no? Plants, walang IV. Sorry. But dogs, ina-IV po. Cats also. Ayan po, that's again the fluids. I think it's NSS na nakasulat, ano? But yan po yung mga hinahang po na fluids. Ito po, this is the cannula. Can you make it bigger? Yan po, no? So parang ano ho, that's a plastic with the the needle. So once itusok po sa inyo, they will take out may backflow. Tatanggalin na po yung needle. It's the plastic that remains. The plastic is the one with the pink. Ayun po. It's the plastic that will remain in your hand. Yun po yung medyo matagal yung swero, like 1 week, 5 days, ganun po. And you receive your fluids and antibiotics through that. So, yun lang po. I think those are the photos. So, thanks so much for joining us. IV therapy is very important na pagsuswero. Most of us know it as napakasakit lang at napaka nakakainis. But rest assured po that it is one of the things that is making you feel better kasi po you're receiving your fluids, lalo na kung hindi kayo kumain, huwag kayong mag-alala. You are eating through your vein and you are receiving medicines that will make you better through your veins. So, ako po, naswero na, my son, naswero, umiiyak. My mom, pina-central line ko kasi nagpa-chemo. My husband, di pa ata na ospital. But I personally have suffered through this. Nung nanganak ako, wala akong ugat na mahanap. It was really a big deal. But you know what? Hindi na lang ho ako nagalit because, well, siguro marami na rin ho ako na-torture in my lifetime. I'm an expert nagsiswero. I have done cut down, central lines, you name it, alam ko. So, nung ako na po yung pasyente, I realized the importance of the SWERO at kahit po masakit, tiniis ko. Because we need to get better. Okay? So, sa inyo po lahat, magandang hapon po. Ikaw, Reina, I'll ask you muna. Are you here?
Yes, Doctor, I'm here po.
Nakapaglagay ka na ba ng SWERO or check to na SWERO or somebody complained about their SWERO? My God, number one issue.
Yes, you won't get certificate. There is a certification for us nurses and doctors for you to be able to insert IV legally. It has legal implementation po. Mai-add ko lang po, hindi po pwedeng basta-basta kung sino na lang ang magtuturok po sa inyo dahil it is it is a bodily invasion ng
hindi biro ito basically. Yes, oo. At yung mga ginagawa sa salon, my God, please don't.
Oo, yung mga I was about to say that and add that, Doktora, no? Buti na lang nabanggit mo. I'm gonna add na yung mga yung mga nagpapagluta, and nagpapa vitamin C drip, they call it drip, no, yung mga cosmetic drip. Yung mga cosmetic drip, make sure hindi naman yun namin yung sinasabing mali, pero ang mali is hindi license yung nagtuturok po sa inyo because pwede pong may mangyari sa inyong masama sa pagtusok ng IV. Very, very delikado yon, right, Doktora? Mamaya hindi pala sa vein.
Sobra.
Mamaya kung saan pala naitusok, dito nagkakaroon, Doktora, yung most common yung yung nagkaroon ng blood clotting because
pwede rin.
Diba?
Kasi if somebody doesn't know, ito lang you can have, it's not actually a blood clot, it's called an air embolus. If somebody doesn't know if somebody doesn't know how to put a SWERO, baka magkaroon ng air doon, it will go to your heart and you will die.
That's true. Very, very yan.
Di ba, did you check muna yung backflow, then ina-adjust, tapos ginaganon-ganon yung you see them making pitik the bubbles up Pag hindi po marunong yan, baka pumunta yung bubbles sa puso nyo, goodbye kayo.
Actually, kaya may nurses na kailangan on your bedside because of the SWERO. We need to watch out if napapasukan ng air or bubbles yung mismong IV or yung IV line, yung SWERO. Yun, we have to make sure na walang bubbles kasi once na pumasok yun, Doktora, very delikado siya. Yun, pwedeng pumutok yung ugat,
Pwede
pwedeng
kang
mag-cause
makatok.
ng,
Oo.
yeah,
And
pwedeng
then 'pag
mag-cause ng,
lumabas pa yung gamot, we don't even, some of them is like chemotherapies and things like that, puwede hong masunog yung laman niyo sa kamay. So, it's very important na the nurse is present and that the nurse is alert.
yes.
The
And
beautician is not alert, okay? And the
yeah,
beautician should not be present.
yes,
And
no,
I will be the one to tell you that these things are a waste of money.
yes. Kasi we will all, ano naman, somehow, we will rot
No,
and
no,
die.
ito lang, your veins are vitally important. Nakakatuwang mag-inject-inject do'n, pero 'pag chemotherapy na ang nini-inject, parang bakit hindi ka nakangiti? O yun. So
Yeah.
basically, I will never let anyone inject anything into me unless it's an emergency situation and that I truly need it to save my life.
Actually, one more question na na-encounter ko sa hospital, no, doktora. Lagi to, very common sa mga nurses. Bakit nurses daw ang nag-i-inject or nagkakabit ng swero? Bakit daw hindi doktor? Kasi it's part of our primary care. Kasi
Yeah.
ang doktor po, hindi po sila magra-rounds ng 12-24 hours para i-check ang inyong swero, ang IV line. It's us nurses who does that. And if there's something wrong, kami ang mananagot doon at hindi si doktor. Yun
Very
lang po.
important nursing function po yan.
Yes. Yes. So, yun
Okay.
po, doktora.
Okay, next question po.
Okay. Next, from one of our viewers, Doktora, bakit ang bagal ng mga nurse sumagot ng tawag? Barado na ang swero.
Okay.
Okay.
Ay,
Ito
nako,
naman ang
parati ko
question para
nakikita
sa
yan sa mga
akin.
vlog ng mga nurses.
Para ba sa akin tong question na to?
Ako na lang, sige, para no bias.
Yes.
The nurses, isa lang sila eh. And sometimes there are 8 patients. So, try to understand din naman po, no? And siguro, you can come to parang intindihin nyo rin sila and sila din po, I'm sure they are doing their best. Kung sana lang po kayo lang po ang iniintindi nila, wala pong problema. Yun eh. But sometimes, somebody might be dying in another bed. So, siguro some understanding and good communication will solve a lot of the problems. Ikaw, Reina.
To, I will definitely agree with you, not because I'm a nurse, but if I may have to add on this, on a very objective aspect, no, sometimes hindi rin namin kayo nare-responde agad or ng mga nurses. Kasi minsan pagbarado, may clinical implication eh. So we have to consult your doctor first. Kailangan tawagan namin sa, Doc, nagbara, anong pwede nating meron bang
Tama naman.
or magpapalit ng swero, ng IV. Minsan sinasadya na namin muna na ipahinga yung vein. So magugulat kayo, wala nang pumapatak. Kasi minsan kailangan magpahinga ng vein mo para hindi tayo magtutusok ulit. Anong mas gusto mo? Magtutusok ulit or magpahinga yung vein? Or minsan sasabihin ng doctor, sige, stop mo muna for 6 hours tong ganitong gamot kasi maglalagay tayo ng ganito. So para may mga instances na akala nyo barado yung IV line, but then yun
Pero
pala
actually,
sinarado
hindi naman.
namin. Kasi
Okay.
pagpapahingayin yung vein, may ipapasok na mas malalaking molecule na gamot. Kaya minsan, kung mararamdaman nyo, pagka may pinasok na gamot, ay malamig. 'Di ba, doktora? Malamig yung
Parang ganon.
yung mararamdaman nyo yung tusok, yung kumbaga yung flow ng fluid sa katawan nyo, mararamdaman nyo na malamig. Minsan naman ang sakit. Kasi ibig sabihin, malalaki yung molecules ng gamot pag pumapasok siya.
Merong ganon. Merong antibiotic na
Yes.
masakit. Kailangan masahihin yung kamay ng pasyente.
Yes. Minsan naman may tinatawag na kailangan i-flush. Kailangan i-flush yung kailangan kasi pag pumapasok po ang gamot sa vein natin, minsan konti lang yung dumadaloy na dugo. So may tinatawag tayong kailangan 100% dumadaloy muna para pag pumasok po yung gamot, makapasok po siya kasama ng dugo. Ayun, madaming kaso, madaming
factors, okay? I'm sure they're doing their best, guys, okay?
yes.
Pero
So yun po yung
talagang
mga
at
conditions.
saka good conversation din po. Communication will solve a lot of the aways, okay?
Yes, agree.
Okay, next question. Don't blame your nurse, guys. Okay, she's doing her best.
Pero doktora, yan ang common complaint sa amin talaga ang swero. Promise.
Talaga, away ng mga tao
Swero
talaga yan.
and catheter. Yan. Yan ang dalawang number one ano namin. Catheter and swero. Diyos ko po, wag niyo pong hinihila ang mga swero at catheter nyo. Wag.
Tama yan.
Wag po. Okay, another question. Maganda bang magpa-IV immunotherapy?
Naku, yan ho yung maraming nagtatanong po sa akin yan, lalo na't panahon ng COVID. Sabi ko, kung kaibigan mo yung may-ari ng salon at gusto mong tumulong sa kanyang kita, magpa-immunotherapy ka. But don't expect na tutulong po yun sa inyong immunity. You will just help the salon earn more. At wala naman pong masama, lalo na kung friendship mo si salon. Okay? Pero kung naniniwala ka doon, it's not true. Okay? Kasi kung merong ganon, di kami na muna doktor, no? Alam nga naman sa salon.
Exactly. So, another
Yun
question.
lang.
Doktora, bakit mayroong nauubusan ng ugat? Ayan. Lalo na yung nakakimo. Okay, doktora.
Alam mo, this is really very sad. And this also happens to yung mga nakadialysis, ganun po, no? Usually, as we tend to give very corrosive drugs, no? Pumuputok at pumuputok po yung mga ugat ng tao. Matatapang po talaga. And this is very common po sa chemotherapy. Some people have to be in and out talaga. So in cases like that, we usually put po what we call a central line na ano po, it's a port para doon na lang ho tutusok into the superior vena cava, which is the main vein entering the heart. My mom had that. My cousin has that. Sa mga dialysis patients naman, they usually put a temporary dialysis catheter, pero kung magtatagal na rin ho kayo, then they put po arteriovenous connection po. At dun po yung AV fistula, dito po, kinukuha at binabalik po ang dugo. So, yun po yun. That's it.
Yes. Okay. So, doktora,
So ito lang sorry, Rains, balikan rin kita. I forgot to so as you're having chemotherapy, talaga pong puputok at masisira ang dugo. Also for dialysis, kung magtatagal kayo, then you need to something permanent. Another issue po, I forgot to mention this, is dehydration. When a person is very dehydrated, kuminsan, hindi naman ho nawawala yung ugat, but the ugat gets so flat, hindi po ma-inserta, hindi makita at insertan. This is really very bad. Or if you become so manas, hindi rin makikita yung ugat mo. Ito nangyari sa akin while pregnant. Yung pala, I was going to heart failure, wala na makitang ugat kasi nga manas ako. So it is so difficult po talaga to put IV in a manas person or a pregnant woman. Diyos ko, pag manganganak ka, minsan ang hirap makahanap ng swero kasi nga manas ang kamay at paa ng mga buntis. Sa mga dehydrated naman or wala ng dugo or like sinaksak, lumabas lahat ng dugo, ang hirap din kasi halos deflated po yung veins. Sa mga ganon, tumutusok po kami sa liig. Okay?
Yes. Okay. Doktora, how long ba dapat nakaswero ang pasyente?
For as long as you need it. Some people, mabilis lang, they got okay, they can take oral meds na po, then no more swero. Yung iba naman po, they have been in the hospital for 2 months, every day of those 2 months, nakaswero po sila. Okay? So yun lang po, for as long as you need it.
Doctor, I was asked this question, no? Wait, before the question, no? Nung nagpa-practice pa ako, I was asked this question. Bakit pa tayo kumakain kung pwede naman palang nakaswero? Yung mga nagda-diet, tinanong ako nito,
well,
diba? Parang, oo, bakit daw?
The way we use our gut is very important. And I've always been taught that if a person can eat NG tube talaga, like sa ICU. Kasi there is something in the gut microbiome that protects a person's body also. So we have to use the gut as much as we can. The gut is our intestinal system. Yung linalagay pong mga nutrition through the vein, pansamantala lang po yun, and it really does not nourish a person. I would not want to subsist po na hindi na po makakain by mouth. Malaking bagay po yung yung microbiome. It's the amount of microbes in our intestines. We are starting to learn that it is actually important. So that's why in the ICU, my boss always used to say, feed the patient kung kaya. Okay?
Agree ako dyan, Doktora. Agree. Kasi there are intestinal hormone, yung mga nagtitrigger ng hormones natin kapag ka nagkakaroon ng intestinal function, no? So, dun lumalabas
Malaking
yung mga
bagay po talaga. We're learning it. Before we didn't know that, but now we know that the gut
Yes. So,
microbes are actually very important.
wag kayong mag-diet
Ah,
via IV.
isa pa, yung mga mahihilig mag-parenteral nutrition or IV nutrition. First of all, I really don't sanction that. And number two, because there's a high amount of glucose, lipids, whatever, there is a huge risk of infection doon. And actually, sa amin po sa ICU namin, when someone is going to start parenteral nutrition or kakain na through the vein or dun po tatanggap ng lipids or whatever, we usually make tusok another line. Make tusok, ang galing Tumutusok po kami ng isa pang SWERO. Kasi pag isama mo po yung antibiotic, yung dugo, tsaka yung yung nutrition or kakain daw sa ugat, may infection yan. Goodbye ang central line mo. So,
Okay,
yun lang
there
po.
you go. That's a very, very satisfying question to the satisfying answer to the question na huwag kayong
Yun
magda-diet
lang.
via IV.
Ay,
Yes,
naku, hindi. Baka
nako,
magkaroon ka ng infection via IV. Okay? Next
yes.
question
Okay,
po.
next po. Doktora, anong dumadaloy sa SWERO? Tubig lang po ba yun?
Bakit? Hindi. First of all, we do not put tap water, distilled water, or any kind of water in the SWERO. That's not good. Kasi nga, the water is supposed to be drank, okay? So, kailangan, as I mentioned before, it has to be compatible with your blood, okay, guys? Hindi tubig yon, hindi distilled water, hindi carbonated water. A normal saline po yan, or D5 D5 binibigyan po ng glucose o 0.45 yung yung amount of salt, and then there's lactated ringers with lactate, so hindi po siya tubig. Water is not compatible with your blood. You cannot drip water, okay? Do not even attempt that.
Okay. Doktora, may na-infected na ba sa SWERO?
Naku, marami, sobra. Lalo na po pag hindi maingat yung you don't follow po yung disinfection protocols and yung sterile protocols po talaga. In fact, when we put central line, nagde-drape pa, nagagaon yung mga tao. Ganun po ka dangerous ang infection. Para siyang mini OR, sa totoo lang, bedside.
Doktora, bakit may cardboard sa ilalim ng SWERO?
Ikaw rin bakit? Kasi yung linalagay na SWERO, nandito, okay? So, yung wrist action mo, lalo na sa kids. So, tinetape talaga siya. Tapos, yung modern na ngayon, may mga plastic, gano'n, mga molde ng kamay. But in PGH, and other government hospitals, cardboard pa rin na binabalutan ni Mano. But basically, that's to stop your wrist from flopping around.
Yes. Yun po.
So don't take it out, guys. May rason yun, okay?
Saka may mga matitigas na ulo na tinatanggal nila yung SWERO nila.
Meron ba, Rina? I'm not a nurse, so these people remove that.
Nakakaiyak. Huwag niyong ginagaya yung sa mga teleserye na ayoko sa ospital. Ayoko nito. Huwag ganon.
Oh my God, don't do that. Kawawa yung nurse.
Sa teleserye lang po yun. Huwag niyo pong ginagawa yun sa totoo. Kasi
I
napakadelikado.
usually see nurses going around fighting with people over their, maltreating their SWEROs eh.
Totoo. Huwag niyo pong tatanggalin yun ng kayo lang. Mamaya, yung kasi, di ba, doktora, may yung karayom nun, although hindi siya needle na aluminum, Although, very flexible yung needle nun, guys. Pag yun naputol sa loob at dumaloy yun sa loob ng katawan ninyo, naku,
Isa pang problema yun.
isa pa yung problema. Naku,
Yeah,
guys, wag na
basically,
wag.
do not make kalikot. Wag, try to maintain your arm in the proper position. If you need something, call the nurse, okay?
Oo.
Don't mess with it.
Pwede
And
naman
don't,
namin
I've seen some
tanggalin.
patients pull out their SWERO. Don't, madugo yun.
Tsaka doktora, pwede naman namin tanggalin kung matigas talaga ulo ninyo. Papapirmahin lang namin kayo ng consent na gusto nyong tanggalin yun. Pero do not attempt to gaya yung mga teleserye na biglang, ayoko
Lalayas
ninyo!
mo.
Lalayas ako! Tanggalin niyo to sa
Don't do
katawan
that.
niyo. Wag,
If you pull
guys.
out your SWERO, dugo po yung lalabas. Okay?
Exactly. Okay, next. Doktora, bakit parating nababara o na out of vein ng swero ng pasyente ko? Ayan, ako.
Sometimes po talaga, no, it really happens. Sometimes, no, yung pagkalagay po ng SWERO, yung, di ba sometimes yung, ang hirap natusok na 5 times, finally napasok. Sometimes talagang, yung pagkalagay pa lang, nakabalance na eh. Sometimes naman po, I don't want to blame patients, but syempre kids, they have to go in and out of the bed, going to the CR, yung iba naliligo. So talagang nagagalaw po yun. That's why we tape it so much. Pero there comes a time na nagagalaw din po yun. And then sometimes it just really happens po na nababara, nagkakaroon ng blood clot sa end. It's no one's fault. It's nobody's fault. Okay? So it really happens. And then sometimes yung mga gamot din po malapot, ganon. So nagkakaroon din po ng ng reaction doon. So all of that can cause a swero po na bumara. Yun lang. Pag bumara,
Yes.
likely the nurse will try to fix it. Pag hindi ho talaga kaya, then we have to do another swero. And that's really nakakaiyak.
Oo, yung mag-IV line
Kaya
ulit.
yung mga tao, inaalagaan nila yung swero nila, lalo na yung mga taong alam nilang konti lang yung ugat nila. So may mga tao talaga, parang sisigaw sila pag lalapitan mo yung kamay nila na may swero eh. Ganon din yung anak ko dati.
Yes. Tsaka ano lang yun,
So
mahapdi
alagaan
lang
yung
yun sa
swero nyo
isa.
guys.
Yes. Okay, next po. Doktora, bakit ba
Wala
pagdating mo
bang
sa
bate?
ospital? Wala po, doktora, sunod-sunod ang ating mga questions. Talagang
Sige, mabilis. Okay.
Okay.
Few questions.
Doktora,
Mabilis.
bakit ba pagdating sa ospital, swero kagad ang sinasaksak sa'yo? Ay, nako.
Yung mga galit sa swero. Kasi po dun talaga dadalo yung fluids nyo at yung gamot nyo. Okay? Next.
Hello po, Doktora Ana Bondoc from Mr. Chito Bondoc.
Chito, are you my cousin? Pinsan.
From Miss Daisy Dulfo Maiso. Good evening po, Doktora.
Daisy, how are you?
From Miss Eugenia Nebrida. Good afternoon po, Doktora. Ang sipag mo pong mag-share ng mga kaalaman tungkol sa aming kalusugan. Salamat po sa napakatyaga mo pong magpaliwanag. God bless po. Mabuhay po kayo.
Thanks, Ma'am Eugenia. Thank you so much po. Maganda yung mga comments parati ni Ma'am.
Doktora, bakit ang sakit magpaswero?
Kasi tutusok po talaga. Number one, it's really a needle. And sometimes, lalo na po pag blood, mahirap. Pag blood transfusion, kailangan malaki, large bore, no? I forgot to explain. Merong maliliit na needle. Yun yung mga 22, 24, ganun. Paliit ng paliit yung number, palaki ng palaki. Kung blood transfusion po talaga or talagang aksidente, you need the 16 gauge. Kasi talagang bubuhos kami ng dugo sa loob mo. Okay? So you need it to be fast. Kailangan malaki po talaga yung butas ng karayom and the cannula. Kaya lang, habang malaki yung like 16 gauge, ganon, talagang mas sakit yung tusok. Some people, they put some anesthesia, which an anesthesiologist injected some anesthesia sa akin. Okay naman, kasi pag naghahanap ng ugat, parang parang sobrang sakit din talaga yung turok ng turok, kaya sana one shot na lang. But yes, aside from the malaki yung needle, though merong maliliit, like for kids we use 22, 24, Pero habang lumiliit yung needle, mas lalo yung chances na nababara. Ayan, Reina. So for an adult, lalo na blood transfusion, we need a large bore needle. And then, bakit siya masakit? Some of the medicines are really, parang mahapde. Meron talaga. Okay, next.
Okay, from Miss Marianne, mabuti. May I ask po, pag nakaswero po ba at pinakialaman yung daloy, meaning in-adjust, what will happen? Kasi po may lola was with SWERO, then pinalakas daw po ang pag-drip kasi mahina daw, sabi ng tito ko. Yun daw po ang naging cause ng death ng lolo ko kasi pinalakasan ng drip ng SWERO.
Um, I would say, there's a reason that your lola was in the hospital. And I'm sorry to hear that your lola passed away. Hindi ko po alam yung details eh. So, ang hirap ko pong mag-comment. Kasi don't know kung ano yung nasa loob po ng swero. Pero as a rule naman po, maingat naman po talaga yung mga nurses and mga doktor. And I'm really hoping na hindi po yun yung naging cause. Opo. But again, ang hirap ko pong sabihin kasi wala po ako doon and I don't know the details. But what I would like to hope for is that nurses and doctors po are very careful kasi po, yes, it can be a big problem po pag hindi po nabantayan ang swero. Okay? But
Also,
siguro naman ho,
Dr.
yung reason naman ho, bakit naman ho napasok si Lola sa hospital. At maybe yun naman po yung naging, I don't know. Mahirap pong mag-comment, wala po ako doon.
Yeah.
But I'm sorry
Hindi
to hear that.
naman, I would have to add with that, Doktora, yung pagpapalakas at pagpapahina po ng drip ng swero, may calculations po yun at hindi po yun basta-basta kasi ni-request nyo po. Halimbawa, the family requested or yung bantay requested, ang hina ng drip, pwede bang pakilakasan? Hindi po pwedeng basta-basta po ganun yon. May calculation po yun based sa body weight, based sa current situation ng patient, based sa number of kung gaano kadami yung ilalagay natin. May computation po siya, hindi po siya basta-basta dahil gusto nyo po or trip nyo pong palakasan. Bawal po yun, Doc. Pwede nyo kaming i-reklamo
doon. No. These are orders po. They are written in the chart and they have to be followed.
Yes.
They are based also on kung ano po yung inihi nyo at kung ano po yung dehydration status po ng inyong katawan. So,
exactly.
Opo, I didn't know that people demanded their own rate. Hindi pwede po yun. Okay, guys?
Doc, nangyayari yan.
Yeah.
Nangyayari
And then,
yan.
there's what we call, wala na akong there's an infusion pump. Doon po, lalo na sa US po, everybody uses infusion pump. Dito po, meron pang mga clock eh. Pero sa US po, naka-infusion pump po talaga lahat. So, everything is highly controlled. So, hindi po pwede na, biglang tatakbo na lang po yung swero. Well, there have been mistakes. I am not one to tell you na wala pong nangyaring ganun, That's why the infusion pump was developed. The infusion pump po, yun talaga, kinakalculate din po yun. And that is a safety measure po sa IV. Okay,
that's the same reason also, di ba, Doktora, na pinipitik-pitik naming mga nurses yung yung swero nyo. Yun. Okay, next question.
Remove bubbles. Yep. Oo.
Doktora, bakit may baka sa live kanina? Ano yan?
Hindi, pinika po namin sa Kawit Cavite yung baka para sa bakuna. We're gonna have a raffle. Actually, it's actually the idea po of my husband. I cannot take credit for it. Lahat po ng nabakunahan dito to encourage also and to reward vaccination for 12 months po. Every month, we'll have a raffle po ng baka. So if you got 1 dose, you got 1 ticket. You got 2 doses, you get 2 tickets. And everybody po na nabakunahan sa San Luis can join this raffle. It will be on Sunday.
Okay,
unfortunately,
great.
nakawala po yung baka. So hinabol po kami. Yung anak ko bilis tumakbo. Ako, naka-crocs. Ang hirap tumakbong naka-crocs. May paputik pa.
Oh my goodness. From Mr. Ray Yumang. Maya pa oras, Doktora Ana. Okay.
Ay, that's my kumpare, an educator and a broadcaster, Mr. Ray Yumang. Thank you, sir.
From Miss Yasmin Apple. Last dextrose ko na magakamay ng gusto. Nagalit pa yung doktor sa ER kasi galaw ko daw. Buti na lang nurse mabait, bigyan ako ng ice.
Well, yun nga yun. Also, sometimes the nurse is busy, so you really need to look at your hand. Kung umuumbok na po talaga, mali na yun, okay? Mali yun. So that means nag-extravasate po yung fluid into your hand. Um, as a doctor, you shouldn't really be, though I have to admit, meron din tong matataray. Pero, show compassion din naman po to the patient. Nobody naman who wants na ma-extravasate yung fluid sa kanyang kamay. Okay? Pero talagang meron ho talaga kung minsan magalaw. So, I guess better communication na lang po. But it happens. Sa mga ganun po, no, warm compress para ma-absorb po ng katawan uli yung extravasated fluid. Swerte ninyo na lang kung fluid yon, kung extravasated chemo, sunog ang kamay mo. So, there is a big responsibility po ng ating nurses in this situation.
Okay, next from Miss Aloha Big Bear Hug. Hello po, Doktora. Pwede po kapag nakakaramdam po ng panghihina dun po sa pagpapaswero, pwede po ba sa bahay? Thanks po, Dok.
Gusto niyo magpaswero sa bahay niyo? Well, some people, like yung mga matatagal na pong may sakit, like mga paralisado pong tao, some of them are really already home care. So, pwede naman pong maswero sa bahay. But if that's not your case, then the only reason po that I would see na magpaswero po kayo is if you're vomiting and throwing up, uh, or extremely dehydrated, I would suggest you do it in a hospital. Kasi po wala rin hong magbabantay sa bahay at baka po may mangyari pa. It's a serious matter.
Alright.
So,
okay, next.
Matapos na ba tayo?
Yes, we actually have last two to read.
Okay, go.
Okay, from Miss Rosemary Tolentino Silvestre. Good eve po, Doktora. May tao po bang manipis ang mga ugat?
Meron. Ako, I would say meron. At kawawa po yung mga yon pag na-hospital. Kasi ang hirap hanapan ng SWERO.
From Miss Cindy Abinas Cantillo. Good PM po. Yung po bang needle na ginagamit sa COVID vaccine ay typical type of syringe? Ang haba po kasi at baon po ba talaga sa laman? Look ouchie po.
It's just a normal syringe. Ano po, I wouldn't say that there was anything remarkable about it. Opo, it's just a normal syringe. But it's normal to be worried. Some people are really worried about needles. Kaya lang, pag kayo po ay na-COVID, baka katakot-takot ho na needles ang makita nyo. So better do the one needle once and the other needle once. Kasi once you get SWERO, once you get COVID, naku, Diyos ko, katakot-takot na needles at SWERO po yung haharap sa mukha nyo. So, better na lang, tiisin na lang po, it can be scary, and I'm not one to say na wala yun. For some people, it's a very serious issue. Though yung anak ko, I have to say, he's 8 years old, and he can be, he's been rabies vaccinated 3 times, hindi man umiyak, even when he was 5. So, nasa tao po yun. Pero what I could advise is tiisin na lang po natin dahil yung alternative mas grabe. Okay. Kaya mo yan, ma'am.
From Miss Mary Ann F.A. Mabuti. Thank you, Doktora and Miss Reina. That's all that we have for today.
Okay, so sa inyo po lahat, the ECQ was just announced. I hope that we take the Delta variant seriously. We use mask and face shield, and we have to follow the government po. Mahirap po talaga. It's really very difficult. Everyone's livelihood ay nakataya po rito. And naiintindihan ko po, but what can we do? So let's just pray to the Lord and do our best po to help the government and to help the Philippines and to help our country and ourselves. So sa inyo, our family and ourselves. Sa inyo po lahat, magandang gabi po. Thank you.